Hmm. कोपरा कुछ रखना कैश ऑन डिलीवरी लेके जा चोर
Hello everyone, welcome to Ka Homeopathy Study Group Pro Bono webinar. Good morning, good afternoon and good evening. So nice to see many of you from different countries and different time zones. Before we start our webinar, always thank Universe for giving us this great opportunity. And Dr. Sweta Singh, our Ka Chief Administrator, will start the session.
Hello everyone, myself Dr. Shweta Singh, Ka Chief Administrator, welcomes our respected speakers, Chairman and CEO Kavita Ma'am, Ka volunteers and all the attendees to Ka webinar. I would like to take this opportunity to introduce Ka Homeopathy Study Group to all of you. Ka Homeopathy Study Group Pro Bono was organized and founded by homeopath and humanitarian Kavita Kuknur, President and CEO of Kavita Holistic Approach, Ka. This study group is intended to be an offering from Kavita to the homeopaths around the globe, sharing goodwill and solid clinical work within the classical model are foundational principles for the Ka. Ka mission and vision are very unique to inspire young homeopaths, mentor, provide excellency for educational purposes using holistic approaches via webinars, which are based on principles of classical homeopathy and provide professional continuing educational homeopathy credits for practitioners. We provide merit certificates for spreading the light of homeopathy around the globe. Dr. Kavita is a member of Kevin Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. She is nationally board certified by Council for Homeopathic Certification (CHC), an Agena CPD provider, and serves as the associate editor for the Homeopathic Heritage. She is the recipient of Martha Ullman Community Service Award by National Center for Homeopathy and Best Entrepreneur Award from Dr. N. Linga Raju, Principal of JSPS Homeopathic Medical College, Hyderabad, India. Tana Telugu Association of North America, a prestigious organization, honored and awarded her for selfless homeopathic and humanitarian services at Ladies' Night Out on October 2022, Michigan. Also, Dr. Kavita received the prestigious Legendary Homeopath Award with joint hands of Honorable Health Minister Dr. Dhan Singh Rawat, Senior MLA, Mr. Harbhajan Singh Chima, Ex-Director Homeopathy, Government of Uttarakhand and Chairman of HomeoCure and Research Institute during National Homeopathic Seminar, Homeopathy, the Future Medicine at Kashipur on 21st August 2022. Dr. Deepak Sharma, Ka Executive, Dr. Rajneesh Kumar Sharma, Ka Advisor, and myself, Ka team were also recognized and presented with Legendary Homeopath Award at the ceremony. We are proud to announce that Dr. Kavita was honored as the Woman of the Year 2023 from prestigious organization NATA, USA. Dr. Kavita was also honored by renowned DTA Detroit Telugu Association Executive Committee on Mother's Day at Michigan, USA with DTA Community Service Award 2023. We are extremely happy and proud that we've celebrated 12 years of her book, Beyond the Limit, A Challenge to Prove Oneself. And in January 2022, we launched her ebook, A Dose of Spirituality with Kavita, in presence of honorable guest of speakers, American Institute of Homeopathy President, Dr. Alex Becker, and Council for Homeopathy CHC President Dr. Sheetal Tiwari at our Ka webinar. At Ka's second annual celebration, our honorable guest of speaker Dr. Jawahar Shah, Chairman of Enlightenment Education, launched audiobook and hard copy of her second write-up, A Dose of Spirituality with Kavita. We are delighted to share that Our spirituality book is going to has completed its 1 year, and we have donated over $1,500 to 10 to 15 charities, which we have also listed them on the website. Dr. Kavita donated the proceedings of the book through KHA Homeopathy Study Group platform to various charitable organizations and homeopathic association. To name a few are Kevin Friendly Foundation, CHC, DHMA, GSPS College, VT Seva, NCH, etc. Interested one can reach us for details at kstudygroup@gmail.com. Purchase link will also be shared. As of now, we have over 350 plus recordings on professional webinars related to homeopathy, health-related topics, and inspirational talks available on our YouTube channel with the name Kavita Kokunur. This webinar is moderated by me and it is being recorded as we speak. We will take questions at the end of the webinar, and we will also post jot form in Zoom webinar chat at the end of the webinar. Please fill the form to receive your participation certificate, and you can reach us at kstudygroup@gmail.com. Kindly mute yourself and turn your video off for better connections. So let me introduce our honorable speaker to you all. We have with us today Dr. Hira Lal Agarwal and Dr. Pooja Dubey. Welcome, sir and ma'am. Let me introduce Dr. Hira to all of you. Dr. Hira Lal Agarwal is a homeopath from Solapur, and he has an experience of 41 years in this field. He is practicing at Sri Ram Homeopathic Clinic and Research Center in Solapur. He has completed LCEH from Sathe Dondhu Mama Sathe Homeopathic Medical College, Pune in 1982 and diplomate IACH from International Academy of Classical Homeopathy, Greece in 2000. He's a direct student of Dr. Vitholkas. We welcome you, sir. Am I audible?
Thank you.
Welcome,
Thank you,
sir.
Shweta.
We will go first with you, sir, and then we will,
Okay.
Dr. Pooja will follow. So looking forward to a great learning. Please proceed for your session.
Yes. Thank you, Shweta, for your kind words and good introduction. So, welcome each and every KHA group members as well as the participants of today. I am at the start only. Today, our KHA group chief, Dr. Kavita, has her birthday. So we all wish her a very happy birthday and we wish her a good life and many more birthdays to come. And she is a lady with a very warm heart and a very, what we can say, sympathetic nature, very highly sympathetic, and thus she can do a lot of work at this end. So coming today with our work or discussion, it's a discussion rather than, so that we can exchange our ideas and whatever learning I have done through my patients will try to share of my experience. So can you see the slides?
Not yet,
Yes.
sir. Yeah.
Now, okay.
Yes, sir.
So all this is as a disclaimer. We see these webinars are for educational purposes. It's an information shared, the experience shared, rather the information. These are experiences that has been shared. And as in homeopathy, case to case, we have to differentiate ourselves and find what is best suitable simillimum to our patient. So this is our main Kavita holistic approach or the platform of KHA group. Now coming to today's topic of urolithiasis or nephrolithiasis, a very common situation that is being seen today. And the causes of it, as we know, are gout, diabetes, obesity, gut dysbiosis, hyperparathyroidism, Crohn's disease, vitamin B6 deficiency, drinking less water in a hot environment, anti-cancer or anti-HIV drugs and idiopathic. So causes also has to be taken into consideration when a person comes with a recurrent type of stones. Now, what are the various types of stones are calcium oxalate, calcium phosphate, uric acid, stearate, and cysteine. And we can see here in the graph, their percentage also. More what we can see are calcium oxalate rather than calcium phosphate. Uric acid is second more, and the very small are the cysteine ones. So calcium, we don't go into details. We'll go more with the cases. So all this much we know. So their formations, their chemical composition, all this has been given here. Signs and symptoms, as you know, it's moderate or severe abdominal pain, loin pain extending to lower abdomen, urgency or frequency of urination, burning pain before, during, or after, many a times hematuria, obstruction of urine or less urine, nausea, vomiting, and sweating, fever, sweats, or chill also with fever, and obnoxious odor of the urine. Now, differential diagnosis, one must know, it has to be clear to all homeopaths that we should know differential diagnosis, we should know their complications, we should know what allopathy also does, we should also have a physical examination, we should also have investigations. It does not mean that a homeopath should not do any investigation, should not examine the patient. Something, there are been a false notion that we don't do investigations. It is not so. We have to investigate and confirm. So differential diagnosis for renal colic or nephrolithiasis, diverticulitis, appendicitis, pyelonephritis. Is it clear, Shweta?
Yes, sir.
Slides are clear?
Yes, sir.
Pyelonephritis, ovarian cyst torsion in females, ectopic pregnancy, testicular pathology, liver disease, urinary tract infection, and abdominal aortic aneurysm. So these are the differential diagnoses we should keep in mind when we are treating nephrolithiasis. क्या over next क्यों नहीं आ रहा है भाई? What are the diagnosis criteria? X-ray, KUB, renal ultrasound, or USB, USG, CT scan of abdomen and pelvis. Now, CT scan is done whenever, today only we had a patient, last 2 weeks or more, he was having this pain in the left renal colic. This was diagnosed as renal colic. But finally, after 2 to 3 weeks, he was not getting any change in his pain. So we did a CT scan of abdomen, and there were lymph nodes which were behind the peritoneum, and this came out to be more of a testicular cancer. So he has testicular cancer more than a. Today only we diagnose this case. So CT scan or abdomen when there is no change in a person after 2 to 3 weeks of good treatment. Intravenous pyelogram, blood test for calcium, phosphorus, uric acid, and parathyroid hormones, and 24 hours of urine collection to know how much of stone collection is there. Complication, abscess formation, that is what happens in a chronic phase. We get goes into a very bad phase of kidney abscess formation, urosepsis, urinary fistula formation. This is mostly with post-operative situation that urinary fistula is formed, urethral scarring and stricture, urethral perforation, and chronic renal failure. Now, prevalent allopathic treatment, what we have is medical and surgical. In medical, they give painkillers, diuretics, allopurinol or thiazides, while in surgical, shock wave therapy, tunnel surgery or nephrolithotomy, ureteric scope, stone removal, and open surgery. Now, what are the preventive therapy? We have to also see prevention better than cure. High fluid intake, wherever the person takes. This is much of a common situation that we see, that people don't drink water. So high fluid intake, that is very important. Limited salt intake to maximum 2 grams per day. Less intake of animal protein. This is mostly with uric acid. Wherever uric acid is more, animal protein, non-veg has to be stopped. Less intake of dairy products in milk, yogurt or cheese, mostly with uric acid. Limited food rich in oxalates and calcium, and reduced diuretics. Now, diet prevention, diet for calcium oxalates. So these are various diets that we can give for calcium oxalate special. Now we'll go for a homeopathic view. Now, in a case taking, it becomes a much important factor in a homeopathic way, because only diagnosing a case from giving remedies from a diagnosis point of view many a times does not solve the problems. We take many a times the therapeutic way of prescription. We say that right-sided stone, give lycopodium or berberis, but many a times it does not suit. So we have to take into consideration whenever it becomes a chronic situation or mostly in an acute phase, the onset, the type of pain, the urinary complaints, urgency, frequency, color, odor, concomitant like fever, chill, nausea, vomiting, past history also. They will give you a group of remedies which should be differentiated depending on the mind, general modalities, and PQRS. This is mostly during an acute phase. When a person comes with an acute phase, you have to take the onset, concomitants, and the frequency or urinary complaints. Then there are 5 ways of prescription. One is totality, causation, constitution, PQRS, and essentials of the prevailing pathology. Now, my cases that I'm showing you or describing you are from 2019 to 2022. There were total number of patients were 132, male were 97, and female were 36. Efficacy of homeopathic treatment: out of 132 patients, 112 became better, 10 continued, 5 went for surgery, and 5 discontinued the treatment. So overall, if you see, we have a very good scenario for homeopathy and their chances of getting better and removal of the stones. So these are the various stones that we could get from the patients. And one of the stone was the biggest one, the first one that we see. So this is the first case. Up to 56 years, non-diabetic, non-hypertensive truck driver by profession, came with pain in the right loin extending to the abdomen and right leg, aggravated by walking, nausea but no vomiting and weakness. Pain aggravated by intake of water, yellow colored urine during pain. Indigestion aggravated by overeating. He was a mixed diet person. He had a desire for meat, fish, chicken, eggs, desire for sweets 3 plus, desire tea 8 to 10 cups and hot. Thirst was 4 to 5 liters per day since he had his urinary complaint. Before the urinary complaint, his thirst was much less. Frequency of urination every 5 to 10 minutes, small quantity and dribbling 1 plus. Pain burning after urination. Stool, there was constipation and unsatisfactory stool. Sweat mildly when heated and on exertion. Season, he was a hot patient in general. Cold season, okay and better in open air. Sleep was unsound due to duty times, but mostly sleeps on the right side, snoring in sleep. He was a tobacco chewer and a BD smoker. Jaundice, typhoid in childhood, frequent UTI, history of frequent UTIs. He was a known case of BP and diabetes and was on the maternal side. On the mind level or mental emotional level, there were 4 people in the family, limited friends, angry about small things, and wanted everybody to obey. So we took this analysis, repertorization, dictatorial, overeating aggravation, warm food desire, hot, pain on the right side, pain extending to ureters down. And we could see lycopodium coming up. Lycopodium 203 doses and SL were given. Berberis mother tincture is one of the best. We will talk about these various mother tinctures that are helpful during kidney stone situations. So follow up after a month, no pain this month, but if he drinks less water, then he gets urinary burning. Now remedy prescribed berberis 10 drops 3 times a day in half cup of water. He was not regular in his follow up as he used to go for long distance work. During last 1.5 years, he had many acute episodes of pain. USG X-rays, IVP were done, but none revealed any calculus, but urine showed a lot of pus cells and epithelial cast. Now, though he was not having any pain or there were episodes of pain. The urine was not very clear. Urine showed a lot of problem in the pus cells and various epithelial cells. On the USG, there were bulky kidneys, increased cortical echogenicity, grade 1 renal parenchyma disease, and serum creatinine was 1.6, which forced him for a nephrologist opinion. He was diagnosed as CKD, making him more worried and anxious. Now see, you will get the twist in the case now. He was better with lycopodium. He was having frequent episodes of pain, but they were much better. But finally, the kidneys were going into a difficult situation, and he was diagnosed as CKD with serum creatinine increased and urine showing a lot of problems. Then one day he came with a very severe acute pain by pressing his hand hard on the loin region at one point, and he said that this is the only way he finds relief in the pain. So he was a truck driver. So he said whenever he used to get pain, can you see me? Hello, everybody.
Yes, sir.
You can see me
Yes, sir.
because I want to show the way he was sitting. While he was driving his truck, he used to sit with the screwdriver and the back and press the screwdriver with the seat behind. Only that tip of the screwdriver should press the painful region, and he used to press hard to the seat behind, and then he used to drive his truck. So this is the way only he could feel the pain was better. So spot pain and hard pressure amelioration. So this was the modality that he used to get. So here is where, and while driving, he used to keep the handle end on the spot of the pain and the other end on the back of the seat and sit bending a little back, creating hard pressure on the pain area, and used to drive. Used to put the screwdriver at the loin for relieving the pain. So if you see kidneys pain, pressure, back pressure of clenched fist into amelioration, only Santanum album was the remedy. We gave him Santanum album, 13 water, 2 hourly, and to our surprise, he passed a lot of sand in the urine for about 2 to 3 days. After this, until today, he has no pain, and the hydronephrosis and bulky kidneys also are normal. So here, if you read the Madra Medica by John Henry Carr, Santanum album, you see in the clinical part kidney ache, and also you see in the characteristic, I have made it bold, pain in the kidneys better by pressing clenched fist into the back. You have to press like this very hard. And this was the modality which made me to think of Santanum. This is the role of repertory. This is the role of small rubrics. This is the role of single remedy, which you should always keep in mind seeing the patient. So though it was a very good case, which helped, lycopodium helped, berberis helped, but these stones were radio translucent and they could not be found on either X-ray nor on the USG, but they were obstructing the kidneys, giving rise to a case of CKD. But finally, for 2 to 3 days after giving Santanum album, he passed a lot of stones, after which he is better till today. So this is the miracle of homeopathy. This is the role of homeopathy. And this finer aspect, if a homeopath can find, then nothing can stop him from going ahead. But you cannot be very lenient, very easy. बाबा आया है kidney stone, दे दो berberis, दे दो lycopodium. So it cannot happen. So you have to be a little bit judicious, cautious, and a little bit learned, so that you can make more better, finer understanding of your case. Now this is the case. You see his various before and after. So the way he was, he's showing here in the picture how he was having this pain, and after that his kidneys also were totally better. So this is the second case. A 10-year child came with history of recurrent attacks of cold, tonsillitis, nocturnal enuresis, and renal stone. He had obstruction of the nose, mouth, and breathing. He had dry cough aggravated by cold water, banana, rainy and winter season, emulated by steam inhalation and turmeric kada. He had recurrent renal stone since the age of 5 years and recurrent UTI with intermittent abdominal pain. Personal history, diet, he was a vegetarian. Appetite was good, he could tolerate hunger. Desires, he had a desire for sweets very strongly. Milk 1 plus, oily food 1 plus, aversion to spicy, sour, fatty food, cream of milk 2 plus. Thirst, he was on a lesser side, but drinks forcefully due to renal stone. He had profuse sweating on head and on after he getting heated on an exertion. There was frequent urging of urination with burning. There was nothing specific in stool or bowel movement. Sleep was sound, position on abdomen, complaints of bedwetting 5 to 6 times per month, salivation during sleep, thermally he was chilly. There was nothing specific in the family history. So here you have repertorization. In the mind, there were 5 people in the family. He was a hyperactive child, irritable, anger, reacts fast, desire for company, shares his toys, fear of alone and darkness, concentration in studies poor. On examination, in the respiratory system, he had rattling sound, enlarged tonsils. Did routine urine test, there were a lot of RBCs. Did USG abdomen, which showed bilateral kidney stone. In the left, there was a stone which was obstructive. So this is the repertorization. Bladder urination involuntary night children in general history of personal tonsillitis recurrent, history personal infections of frequent, kidney stone, fear of dark, fear alone of being, position abdomen on, and sweet desire. From this, if you see many of the cases, about more than 50-60% of cases, when you repertorize, you will have lycopodium as the main remedy which comes up in major of the kidney stones. So when you put this, here you have lycopodium, sepia, medorinum, pulsatilla, silica, belladonna, carcinosin, and phos. So differentiation of all these has to be done. Otherwise, we become very difficult for us to understand. Lycopodium 30 was given with saccharum lactose for a week. First follow-up, no episode of recurrent tonsillitis, no abdominal pain, no UTI. Bedwetting was frequently reduced to 3 to 4 times in a month. Irritability, fear of dark, fear of alone, no change. Nail biting was there. Now the second remedy as an intercurrent, medorinum 1M was given 1 dose and SL was given. So in the second follow-up, after 2.5 months, the recurrent coryza and tonsillitis are much better. If it appears, then settles in a day or two on their own. The redness of tonsils is much reduced, but the size is the same. Abdominal pain intermittent, nose obstruction is much better. Irritability and poor concentration. Rest no complaints of bladder and bowel. So what we see here is after lycopodium as an initial remedy during that acute, medorinum came as the best remedy. Now, why we didn't give medorinum as the first remedy? If you go back and see, medorinum was there also coming up, but medorinum was coming on the third situation, and the acute was given as lycopodium, and we could see that after that medorinum, he came up very strongly, and then we gave calcarecarb 203 doses NSL for a week because he had history of getting wet in rain, sweating of the head, especially occiput. So what we see here in this case, we say as trio of remedies, sulfur, calcarea, lyco. So here we saw after lycopodium, medorinum came in, and after medorinum, we could see that he was better with calcarea carb. So it's not a cycle means or follow one after another. The remedy should not be given one after another. There has to be a symptom complex of the remedy. We could see the symptom complex of the remedy very clearly. Unless and until you see a symptom complex of the next remedy, you cannot prescribe the remedy. It's not that I give lycopodium first, then give sulfur, and then give calcarea carb. You cannot give one after another. You have to have some confirmation of the next remedy. The next layer has to be seen very clearly, and that clearness should come through the symptomatology only. Here, calcarea carb, what was the confirmation? he was getting history of getting wet in rains. Then sweating of the head, especially occiput. That was very clear. These two symptoms confirmed calcarea carb. So we gave calcarea carb, and that too not 30 but 200. Sixth follow-up, after 7.5 months, today suddenly at 7:30 started with pain in the right loin region with vomiting 2 times, pain before urination, flow was normal, no frequency, color a little bit yellow, no fever or chill, no history of any food change or cause. Again, we went back to Lycopodium, 13 water, 1 hourly, and Croteva neurului. This is again a good mother tincture for stones. Drops in half cup of water to be sipped 1 hourly. 7 p.m. on the same day, phone call, no change, rather vomiting increased. Watery vomiting, cannot tolerate few sips of water. Abdominal pain increased after, emulated after vomiting. The pain in abdomen is emulated after vomiting. So what shall we do? Again, acute situation. After giving the remedy which I was helped before, now this time did not help at all. So what shall we do? Question to the audience. Anybody can say anything? Yes, Shweta, just see if anybody can answer any question. What to do now? Now, these are the acutes. We should be able to manage. We should be able to take care of their pain, vomiting. Otherwise, once they land up in the hospital, then it's a bad name for yourself and bad name to homeopathy. So all these acutes, if you are able to manage the acute successfully, managing the chronic is not a very big situation, but the acutes has to be managed. Any answer from the audience, please, out of the 26 participants?
We received one
What shall
answer
we do?
from Dr. Yes, sir. We received one answer from Dr. Korean. Change the potency. Dr. Vivek Daga, increase the potency. Dr. Zeenat Fatima, acute remedy should be given. Any more
Okay.
answers? Yeah.
So what we did, just see. क्यों नहीं आ रहा रे छोटू चिकू? So these are the reports. We could see report of 2nd May, report of 2nd May in the WBC urine, here USG, and here the report of hemogram. Hemogram, you have hemogram report, you have USG report, and you have the urine examination. You could see WBC 15 to 20, RBCs 40 to 60, and occasional epithelial cells. Leukocytes were increased 8,300, hemoglobin was low, and hydronephrosis, there was mild hydronephrosis, and 6 mm lower ureteric calculus close to the right UV junction with grade 2. So this is the case. What did we give? It was osmum can. If you see vomiting with ureteric colic, the remedy comes as osmum can. Osmum can was given, and after osmum can, not only the pain and vomiting relieved, but he even slept that night well and passed the stone. So this is the testimonial of the video of the mother and the child. So it's a video, but I think due to short time, shall we play the video or shall we not play the video? She only says that what was the way in the night she slept. Shall we run the video?
Yes, sir. Please.
I don't know why it is not. Anyway, so we'll go to the next case. So osmum can was the remedy which helped this child. And if you see the rubric, you will see kidneys pain, ureteric accompanied by vomiting, and kidney pain accompanied by vomiting. Osmum can only comes in these two. So increasing the potency or changing the remedy does not help. But during that acute, third option was okay. who gave the third option was correct. You have to change the remedy. It came to Osimum can as the remedy, and that helped very well this child. So this is the third case. Female aged 55 years had a telephonic consultation, and she complained about heaviness in the left lumbar region, sudden ineffectual urging for urination, scanty urine, constant stitching pain in the urethra, unsatisfactory sensation after urination. All above complaints are last 4 to 5 days only. So this is an acute case that has come up. On further interrogation, following symptoms were noted: no desire to work, lethargic, sleepiness, thirstless, need fan constantly, and was feeling very hot. So if you put here bladder urination, urging to urinate ineffectual, urethra pain, stitching, urine scanty, desire to lie down, and sleepiness, you have nux vomica, apis, sulfur, cantheris, lachesis, phosphoric acid, and phosphorus. What will you choose? Yes, our participants. Any answer, Shweta?
Not
Out
yet.
of this group of remedies, out
Yes,
of 25 participants, who will choose what remedy? Question
Dr.
to the
Vivek
participants
said,
fast.
Dr. Vivek wrote Apis, Dr. Konen wrote Apis in acute stage.
Very good. So it was more an apis. Now considering her thirstlessness, industrious nature, and hot patient, we distillate to apis, sulfur, and cantheris and lachesis. On further distillation is achieved by reading the Mater Medica. Apis was confirmed by the sudden rapid development of complaints and desire for milk. So this was the confirmation from the patient that apis was confirmed. Otherwise, these were the four remedies: apis, sulfur, cantheris, and lachesis. Apis was confirmed by the sudden rapid development of complaints and the desire for milk, which was very clear and strong. So apis mellifica 200 in water, 3 hourly. Follow-up of the next day, you have the ultrasound also. Heaviness in back is better. Urine output increased. Stitching pain in urethra is the same. Drinking water forcefully, it means she is still thirstless. Urine satisfactory sensation 1 plus only. Advised to continue Epis 200 but added berberis mother tincture to it. So here you see in the report hepatomegaly with grade 1 fatty changes. Left hydrourotonephrosis with calculus in the left vesico-ureteric junction. Follow up next day on 10-3, generally much better. Heaviness in the left lumbar region is still felt. Urine quantity has increased. Dullness, lethargy is better. Sleepiness also improved, but stitching sensation in urethra rather has increased. So what next? Stitching sensation in urethra has increased. So during acutes, all these smaller changes must be taken into consideration. So now advised Epis mellifica 1 m, 3 doses in a day, and Berberis vulgaris 15 drops TDS in water. Much better from next day after starting Epis 1 m. Stitching pain of urethra much better around 80%. Advised to stop Epis and continue Berberis. Here you see normal scan. They say now here the normal scan. And then she passed the stone also. After Epis she passed the stone. Here I did not put the photograph of the stone. She passed the stone after Epis 1 m, and the stitching pain also gone. And you can see that the ultrasound of which date is this is 15-3. The ultrasound showed there is no stone at all. She passed the stone after. So in about 5 to 7 days, you could see that the stone was also passed away. Now this is fourth case. Child around 1 year age was admitted in the hospital for acute complaints of pain in abdomen, vomiting, scanty urine, fever, irritability. Investigation showing urine albumin 3 plus, pus cells more than 200, RBCs are nil, epithelial cells occasional, USG right-sided pelvo-ureteric junction obstruction. Treatment in the hospital with IV saline, antibiotics, antiemetics helped him for the acute scenario. But surgery was advised immediately to relieve the obstruction. As parent could not afford surgery, they opted homeopathy. So this is the case. Here he had an obstruction at the pelvo-ureteric junction, and these were the reports. This is the child which came from the hospital. This is a small child, and to relieve the obstruction, they said that surgery is needed. So this is the case. First child, full term, normal delivery of a non-consanguineous marriage. Birth weight were around 2.3 kgs. Milestones were normal. Had diarrhea during dentition. Vaccines, BCG, triple polio given is mostly on mother's feed. Mother's history, first pregnancy, basically from Bihar, had come to Solapur for job. Appetite normal, desires sweet, spicy, aversion to sour, desires food and tea hot, acidity by eating lentils, dal, chana, cold water aggravates. Urine nothing particular, mental likes company, irritable, fastidious for work, fear of dark, alone people, history of discord in the family. So now this history is of whom? This is the history of the mother. Remember, not the child. The child cannot give all this history. So this is the mother's history, and the mother's history revealed all these things, from which we gave her the remedy lycopodium. And you could see that the child was better without surgery, and he was so better. So this is another case, not that case. The After about 2 weeks, the child was very well. The reports were quite good, and he needed no surgery. So next case, sixth case, before and during. So you could see the descent. Here I am showing you the case. Here you can see from the arrow, the stone was high up in the kidney situation or the ureteric situation. Here during the treatment, the stone could descend down. So this descent also can be seen by remedies. Here this case was also given berberis and lycopodium. So this is the biggest stone that passed from in our clinic. So it was more than 15 or so. During the passing of this stone, it had got obstructed in the urethra. It was a very bad acute situation, but somehow our remedies helped him to pass the stone. So if you can see remedy lycopodium, what we see in lycopodium is there is a lack of confidence, there is a fear of responsibility. It's mostly a right-sided remedy. So right-sided ureteric stones or kidney stones are mostly lycopodium. During the acute also, you can think of lycopodium very seriously and you can go for it, but there should be some confirmation for you. Like in the abdominal complaints, there should be gases in abdomen. There in the throat, you should have an aggravation from taking cold things, or there should be irritation in the throat by cold things. Lentils or cabbage aggravation, onion aggravation, desire for hot tea. All these things, there has to be some confirmation to give lycopodium. It's not that just because it's the right-sided stone, you can give a lycopodium. Fear of dark, ghost alone in the house, sleeps on the right side, impossible on the left, one foot hot, the other cold, heels are cracked. Desire for sweet is very strong. Desire for warm drinks, cannot bear tight clothing around waist. That is again a very good hallmark from lycopodium. For lachesis, you have around the neck. For lycopodium, around the waist. So if you can get some symptoms, at least three symptoms, what Kent said as three-legged stool. Apart from right-sided stone, if you have 3 to 4 good confirmatory symptoms, you can definitely give lycopodium. So lycopodium is a club moss, which there are needle-like scales. Many species have cone-like clusters of small leaves, each with a kidney shape. So even from the theory of signature, it has working on the kidney. It has a kidney shaped spore capsule at its base. Common name club moss, staghorn, wolf's claw. So staghorn stones that are also there are helpful for lycopodium from theory of signature also. In olden days, club moss tea was used for various urinary complaints. There is another Chinese club moss. It contains huperzine A, chemical which is thought to be useful in neurological diseases such as dementia, memory loss, myasthenia gravis, and Alzheimer's disease. So the Chinese club moss is not the club moss that we use. It is more for a neurological situation. But what we use, lycopodium or club moss, is the other club moss, not the Chinese club moss which contains huperzine A. We have to understand this. There is a lot of difference between these two club mosses. Now, Berberis vulgaris, what is the importance here? It relieves the pain caused due to movement of kidney stones. As far as possible, painkiller should not be taken during the acute pain unless and until it is very bad, because whenever there is a pain, there is a movement of the stone forwards. So if you give a painkiller, it stops the movement and then the stone does not descend further. So the person has to take some pain or should not take much painkillers during the acute phase. It reduces other symptoms like sweating, nausea, and vomiting. It soothes the pain in the lower back or pain that shoots towards the bladder. It reduces the bubbling sensation. That is again a very peculiar symptom of lycopodium, bubbling sensation, and relieve bubbling sensation in the kidneys and relieves other discomforts. It soothes. This is also in berberis. It's also in lycopodium. It soothes the burning sensation and pain in the ureters and urethra. It strengthens the urethral sphincters, used to prevent recurrent kidney stones in some cases, and prevents the formation of calcified crystals, which are the major cause of kidney stones. So this is berberis. That is why berberis can be used with without any fear in cases of nephrolithiasis or ureteric stones. Phyllanthus neurale is again a very good mother tincture that can be used. It inhibits the growth and aggregation of calcium oxalate crystals in calculi. It inhibits the calculi formation while also altering their shape and texture. It produces a matrix-like material on the surface of calculi. It can change the appearance and texture of calculus. It is given to hyperkalemic patients. It lowers the urine calcium levels and lowers excess uric acid in hyperuremic individuals. So Phyllanthus neuri is also a very good substitute or other remedy which you should keep in mind apart from berberis. Cretia neurula. This is again a very good remedy. It prevents stone formation due to its anti-logarithmic activity and anti-crystallization property. It decreases the urinary pH towards acidic. The diuretic action of this drug attributes to the metabolic correction of the serum and urinary electrolyte level in experimentally induced urethritis in albino rats. It helps to deactivate glyconate oxidase enzyme, which decreases the extra production of oxalates, hindering production of calcium salts. Now, initially, when we were doing or in olden days, now nobody gives in the urinary situation the pH of urine, and all those details in the urinary complete examination of urine. But when you examine the urine more in a more detailed way, then it's very helpful for us to understand whether the urine is acidic, alkaline, what we can do. From that angle, all these mother tinctures can help you very much. So remedy used mostly in all my 132 cases where, as you saw, lycopodium was the highest in 52 cases. Second were calcarea carb. All these remedies were used. So a lot of remedies are there on the list which can be used. Benzoic acid again, which has strong smell of urine. Sulfur, carcinosin, Apis mellifica, pulsatilla. So these are the remedies that were mostly used by me in 132 cases that I have done. Mother tinctures, Thuja, Phyllanthus neurale, Cratella, and Berberis. Berberis again the highest of all. So take home message, acute remedy should be quickly selected. They should be, because acutes are more better, and you can have a better understanding of the remedy during the acute phase. Selection of the potency is also very important during the acute phase. Importance of repetition of medicine, constitutional anti-miasmatic prescription, role of lifestyle, drinking water facilities for prevention of recurrence. Lot of people now, because the cities are getting expanded, many people drink bore water. So these are more hard waters, and that is why a lot of people come with stones and also with hair problems. So frequent surgical innervation can be avoided. Homeopathy is more reliable and confident than allopathic treatment. This is what I think we should take home. These are the references, and these are the thanks to my. So now any questions at the end of the phase, as Shweta says, after finishing the second, my co-reader, and then we can take case, question and answers. I think homeopathy has a very good role. We should have faith in ourselves. The younger generation that is coming up is a little bit in a dual mind of whether to do homeopathy or not to do homeopathy. But homeopathy, as I said, even in one life is will be small for you or short for you. There are a lot of things we should learn, especially when you read the repertory or go through the repertory. You have rubrics, small rubrics, and rubrics with one remedy. Those should be found, and they are the gold gem for you. Without any hesitation, if you can give that, you get the results very beautifully and very quickly. So I urge, or I tell my younger generation that they should read not only the Materia Medica, but they should read the repertory very meticulously, so that they should come across with these small remedies as well as remedies with rubrics with single medicine. Thank you very much, everybody, for attending, though being a busy day and a Sunday. And I also thank all my co coordinators of KA and my colleagues of KA for making this evening quite comfortable for me and easy for me. Thank you, one and all participants, KA and especially Kavita, for giving an opportunity to share my experiences on this platform, and wish her all her best for his today's birthday. Thank you.
Thank you so much, sir, for such an interesting session. It was a great learning and learning of rare remedies which can be useful in renal stone, and about judicious prescribing in any case, and overall an excellent presentation. And we will take questions at the end of the session, second session. Now let's welcome our second speaker, Dr. Pooja Dubey. She's an associate professor in Sophia Homeopathic Medical College, Gwalior, PhD scholar of Homeopathy University. She's a guide in MD in Jivaji University. She was an ex-assistant professor at Sagar Homeopathy Medical College, Sagar, gold medalist in BHMS by Dr. Hari Singh Gaur, Sagar University, MP. She's an executive member of Scientific Committee Board in Asia. She has published many national and international articles, and she's a national speaker. She has received Idol Award by Asia, and she will be speaking on utility of keen observation to get simillimum. So welcome, Dr. Pooja, to KA platform.
Thank
You
you so
can
much.
you can proceed with your session, ma'am.
Just Shweta, is this visible now?
Yes,
Screen
ma'am.
share?
Yes, ma'am.
Thank you.
Please unmute yourself, ma'am.
Am I audible?
Yes.
Okay. Thank you so much, Shweta, for your great introduction. It's really indeed privilege to be here at this platform. And I'm very happy that today I got an opportunity to say something about my experience in front of you all. And I would like to thank KHA President and CEO Dr. Kavita Kupunur ma'am for giving me such opportunity. And I would like to wish her for her birthday. And today is her and her son's birthday. And she is not here with us. So I would like to convey my blessings, love, and prosperity for her also, and for her son also. So it's a great privilege. Today, our topic is utility of keen observation to get the simillimum. मैं तो इसको large कर लेती हूँ. हाँ बता ना इसको जल्दी इसको ऊपर करो जल्दी. इसमें कुछ प्रॉब्लम Okay, sorry. Okay, now the topic is very precious topic for today. This is all about the utility and of the keen observation to get the simillimum. Why this is important? Actually, this is very important just because of if any patient comes to your clinic. So very important thing of your observation in front of your patient. When patient enters in your clinic, so what need to observe? Like if patient is having high rise fever and patient is very dull, very prostrated, very weak, so definitely you can rule out some medicine like arsenic and many gelsemium and all. So if patient is very energetic, you can think of some slots of medicine like tarantula and more medicine, which is highly actually energetic and comes in your clinic. So this is the very important thing. If patient comes to your clinic and without asking any question that may I sit or something like that, or patient is sitting in front of you, so this is the important observation you need to understand. So this is the important thing. So observation is very important. It's a great uh, it play a great role in front of your patient, because patient doesn't tell you that I have such kind of problem and I am egoistic, haughty and all. So if you are able to see everything, that stooping is a worst position. Like if you know that about sulfur, patient already um, sit over there without asking any question, may I sit or not. So sulfur is gate indicated medicine. So there your observation play an important role. Natriumure patient, very egoistic, very introvert. So this kind of symptoms, this kind of observation you need to understand. Patient will never say like that, I am introverted or I am reserved kind of personality. So you need to observe. So observation is very important to identify your remedy, because you have to be very keen or very smart to get the simillimum. So some sorts of medicine, 5-6 medicine has to scroll in your mind after seeing your patient, after entering your patient in your clinic. So this is the very important factor to get the simillimum. So that is why I have chosen this topic, which is very playing a great role to get the simillimum. And you all know very well that observation in unprejudiced observer, like when patient comes to your clinic, so you have to be unprejudiced, you should not prejudice. So that will help you out to understand your patient in front of you.
Sorry to interrupt, ma'am. Your slides are not moving. You're on first slide. It's moving now, ma'am.
Is it visible now?
Yes.
Hello,
Yes, ma'am.
Shweta,
It's
is it
visible.
visible now?
Yes, ma'am. Can you hear me? Hello?
Is it visible now?
Yes, ma'am. Can you hear me? Am I audible?
Shweta?
Yes, ma'am. Am I audible to all?
Okay, so now I'm going to tell you a 4 temperament. So these all are very important, just because of if you see your patient, so you got a number of the medicine. You so many medicines scroll in your mind. So patient can be melancholic, choleric, phlegmatic and sanguine. So you have to identify the variety of the patient. This is the very important thing. So that will help out to understand the what kind of patient is having symptom and all. So if patient is melancholic kind of, so definitely you will find patient will be very moody, anxious, rigid, sober, pessimistic, reserved, unsociable, and quiet. So in what medicine you will find such symptoms like ignatia, natrium. So they all are very reserved, sober, and very introverted kind of person. So definitely you have to come to know the features of the medicine and temperament. So all are important, playing a great role to identify. About choleric, the patient will be touchy, patient will be restless, aggressive, excitable, changeability you will find over there. Patient will be very impulsive, optimistic, and active. Phlegmatic patient will be very down to earth, very cool and calm kind of, very careful, very passive type of people they are. Thoughtful, always peaceful, like they always want to be or in discussion they always want to be very cool and calm type of discussion in front of you. So these are the symptoms you need to observe. This is the very important thing. Even tempered, they are very simple kind of person. You will find in such symptom like silesia, or you will find such symptom in phosphorus. So all are the great medicine where you will find the phlegmatic temperament. Sanguine, having a great leadership quality. When there is the rushes of blood towards the head and patient is having more like a talkative kind of people, they are very social, they are very lively kind of, matlab, having leadership quality everywhere. You can say that in belladonna you will find, in sulfur you will find, leadership quality you will find in there. Why? Due to sanguine attitude, due to rushes of blood towards the head or towards the body, where anywhere. So this is the very important thing you need to understand why this is important. Choleric, you will find in Nux vomica, everywhere they are irritable kind of personality, restless, aggressive nature, very impulsive. So this is the thing you need to observe when patient is having such symptoms. Now the important thing, dominance, very important thing ki when patient is having right brain dominance, what characteristics you will find in the patient. So understanding is very important. When right brain dominance will be involved, will be there, you will find such symptom like sensitivity you will there, and you will achieve the creativity in the patient, imaginative kind of people they are, artistic approach you will find out, and drawing and poetic, artistic and approach will be there. So you can observe when patient is briefing their symptom, you have to observe. So this is the very important thing. Spiritualistic, like they always used to say, I found always doing worship, I spend 10, 15, 20 minutes for meditation. So these kind of symptom they will explain. Hysterical patient, you will find philosophical, go saying something, and then again they enter in different something, so go always in the philosophy in brief form. Illusion, delusion, you will find over there. If the left brain dominance characteristics, what you will find over there, like patient will be analytic, positivity you will find, logical attitude will be there, and mental qualities are more, always used to do something different, always go to achieve everything different, workaholic kind of people they are, industrious, and money minded. Money minded is important because they always wanted to be for making money, how to do, where to do. So they are calculative in form. Competitive you will find when you are taking case taking from the patient. So the dominating type of people they are, very important thing. So when you interact with your patient, so definitely you will find some symptom when there is left brain dominance will be there. Mental and genetic understanding of the human being. Why? When you're interacting with your patient, so definitely the patient may be introverted, may be extroverted. As I told earlier in last slide, that when atramure patient enters in your clinic, they will be very reserved, introverted. Whatever question you ask, only they answer only the point two, that are you good, are you okay, what kind of problem you have, only on one or two words they will answer in front of you. So these are the observation you need to understand. But sulfur is a great orator. Without asking anything, patient will explain everything. Bolstering activity, you will say, like there you will achieve that sulfur patient is there. Without asking, patient will be sit over there. Okay, so this kind of observation you need to understand. The patient will be extroverted or introverted. You have to observe. Craving aversion, patient will accept. Already explained towards you, because it's a subjective symptom. Willpower is also playing a great role, because where there is involvement of the melancholic kind of temperament, the willpower will be very low. And if you talk about the Kali personality and different lacases and more medicines, so there will be they are actually hard hearted. So we can think of that their willpower will be very strong. Intellect is also playing a great role, because uh, if some patients are coming to you and they are asking again and again about the medicine, like if you have prescribed any medicine, patient will ask one time, two time, and multiple time, ki blue cap medicine where I have to take, or green cap when where we how many times we have to take. So multiple time the question will be there. So it will justify or dignify the actually intellect of the patient. So definitely then we can think of about the baraita and different kind of the medicine where the question about the intellect. Morals is also important. Sensitivity is also important, because some patients are very sensitive to everything, sensitive to rudeness, sensitive to criticism, sensitive to jokes and everything. So we have to observe when there is any kind of symptoms or questions answer session will be there. You need to analyze the symptom from the patient. There your observation actually role a better way to analyze or assess the any case. Emotional reaction is also playing a great role. Like if you are asking any question and patient is very emotional kind of, uh, talk about pulsatilla. So pulsatilla is very naive, pulsatilla is very mild and very gentle kind of lady. If you are asking, initially she is very shy, very gentle, very yielding kind of personality. When you are asking anything about her problem and something like that, so she will initially she will not explain anything about her, but after some time she start crying. So she is very emotional, and when you get familiar with her, definitely she start crying and explain everything about her or about her family, everything. So this is the emotional attitude you need to understand, that patient is belonging to this group or not. Netramural patient is very irritating kind of rudeness overloaded, बहुत ही ज्यादा rudeness होती है. And there is a very contradiction is also like ignatia, but ignatia is more contradictory medicine. Like if there is a contradiction to everything, Natramur or ignatia you can think of. And conscience and activity both are also playing important role to understand any patient or any medicine. Introvert, extrovert, how will you identify कि patient is having introvert quality or extrovert quality? So these symptoms are playing a great role to identify that patient is having this quality or not. So I think time is very less, and don't need to explain each and every slide. So you can go through this. And so these kind of symptom you will find that patient will be timid, abrupt, haughty, secretive. Stasis is also very important rubric you will find in CPR, and many more medicines. So these are the symptoms you will find out if there is introvert and extrovert attitude in the patient. In extrovert quality, definitely vivacious, wandering, jesting, childish behavior, boaster activity, open-hearted attitude, and wordlessness like Aurum Met. You know well that Aurum Met is a very conscientious, very industrious, and workaholic kind of person. When he or she is losing anything, there is a feeling of the worthlessness. So it's a sign of the introverted nature, um, extroverted nature when patient is having such kind of problem. Erotic, lewd nature, when there is extroverted nature, definitely you will find the amorous kind of activity or adulterous kind of activity in the patient. So these are the symptoms which is very helpful to identify. Shweta, is it moving again? Because it's not scrolling.
No, ma'am.
Intellect, poor intellect, good
Sorry to
intellect,
interrupt,
both are
ma'am.
also playing.
Excuse
But
me.
these are much
Am I
interesting
audible?
topic. But you need to understand that if patient is having good intellect, so these kind of symptom you will find over there. And like memory will be active, comprehension easy, there will be reading desire, sharpness of the mind, occupation, diversion, and amelioration. Always there will be mathematic aptitude, will be very uh, good for them. But poor intellect, you will never find out that mathematical aptitude you will find in the patient. Memory will be very weak, forgetfulness will be there, idiocy and idiotic behavior everywhere, like Baraita and every Baraita Mure and Baraita Carb kind of medicine you will find. Childish behavior will be there, concentration like flickering activity and lascivious activity can also consider in this. And ideas deficient of concentration difficulty will be there, and mistakes always they are repeating again and again, and something problem is there in this slide because this is not moving. Shall I start with my phone because something is issue in this laptop? No,
Moving,
started.
ma'am.
Okay.
Can you please?
So emotional,
Hello.
when there is emotion is considered, you will find a symptom that the patient will be much anger and sadness, grief attitude, grief nature, joy, fear, and contentment. This kind of symptoms you will find in the emotions. As a doctor, what we need to notice in our patient, this is all about the extroverted introverted nature. As I told earlier, posture is very important. Previously I already shared about the sulfur, that stooping is a worst position of the sulfur. So posture is also you have to note down ki what kind of posture patient has beard. So when patient is having fever and patient is coming to your clinic by dancing and very hyperactive, definitely you can think of a about tarantula and more medicine. And when patient is dull, when patient is weak, prostrated, you can think of about arsenic, gelsemium, and many more medicine. So this is also having a great place to get your simillimum. Again is facial expression is also like it says, patient is always having the different kind of facial expression, like mischievous activity, or always suspicious in nature, or different kind of face or a facial expression they will show in front of you. So you need to observe. Patient will not say about. And temperament, I told you before 4 5 slides that melancholic, bilious, choleric. So these kind of temperament you need to observe also in front of your patient. Intellectuality is also important. Activity, patient is slow or fast, this is also important, playing a great role. Because if patient is slow, so definitely you have to think of about some medicine like Calcarea group or Barita group or something like that. Okay, and carbon group also. And if patient is fast, so different kind of patient like Kali group, because the patient are very much anxious or very much energetic or disciplinary in all things. So they are always doing their work in fast manner. And uh, Agentum nitricum is also a great example. When the patient is coming into your clinic and patient is very hurried, worried manner, and when he is or she is in lane, so definitely she will be very anxious and always wanted to be in first or second line of the patient, just because of anxious or anxiousness or hurried and worried manner. So they always wanted to be in priority कि डॉक्टर हमें पहले देख ले, बाद में नहीं देखें. So these all are the symptoms you need to understand there. So these activity you have to notice. You need not to ask in front of your patient, you have to observe. So anxious nature, fearful expression, timid. If patient you are asking any question to your patient, a patient having timid nature and they are not explaining whatever you are asking, so timidity you will find out, like Cilicia, like Lycopodium, like Pulsatilla. So all are the medicine you need to understand ki patient is having such kind of activity or not, or facial expression or not. If patient is happy, definitely sanguine temperament over involve over there, you have different kind of medicine to search out. Sad patient, so natrimur, ignatia, or a med carcinosin, different kind of medicine you need to shortlist. And many more medicine, I'm not only talking about 4 5 medicine, different kind of medicine we have in our materia medica, because materia medica is an encyclopedia. But encyclopedia, by your observation, by your assessment, we can think of about some medicine to identify that whether we have to choose or rule in these medicines or not. So this is the duty or responsibility of the doctor, ki how we are treating or tackle, how we are tackling this kind of case, ki whether this is belonging to this medicine or not. If you're talking about Calcarea group, definitely Calcarea is a very good medicine. I will tell you, like a patient is very slow, but in physical or mental activity, people are very good, they are good doing their job in a creative manner. But the question is there that they are very slow mentally and physically both, so that is why they are doing very late work, and they have not capability to do great work in mathematic arithmetic calculation, like midorinum. Midorinum is also a very good remedy where you find the deficient arithmetic and mathematical calculation. So these are the symptoms we need to understand, that whether actually patient belongs to this medicine or not. So many medicine and medica, like if you talk about the sulfur is very intelligent. Sulfur is a great orator instead of listener. Always when patient comes to you, they start saying anything or everything about herself, himself, or about their family member or everything, because they have a bolstering activity like lycopodium. Lycopodium has also same manner, but lycopodium is some kind of manipulative or ambitious and all, but sulfur is very intelligent and honest kind of person. You will find cunning attitude, because slide is not moving. Why it's happening, I don't know. I will share my slide towards you all, but I am going to explain every medicine in front of, because already time is going on and the slide is not moving. So I am one by one, I am going to tell you about the medicines. I was talking about the sulfur. Sulfur is a very good medicine. Patient is very hot, very thirsty, and having great sweet desire. If we compare with the sweet desire, definitely lycopodium is also will be there. Calcarea carp and calcarea group is there, where there will be sweet desire. And calcarea patient is okay, calcarea group is here. Patient is very slow mentally and physically both, but desire is more. Desire is more like, I have to be an IS officer, I have to be a good businessman, successful person. Everything they have a great desire, but capacity is more, not much. So due to impaired capacity, due to not proper capacity to do something new, or to actively perform their work, so what happens, there will be withdrawal kind of symptoms come. There will be outcome, it will be very less. If there is no outcome, so definitely your desire is nothing. So desire success not achieved. Whatever they have desire to do something different, something new, but they got frustrated. Why? Just because of no practical approach is there, no workout, mind is slow, body is slow, everything is slow. So due to all that, achieved is nothing. कुछ काम ही नहीं हुआ है. तो what happened, frustration will be there. So due to all that, insecurity comes in the patient, and it converts into anxiety. And anxiety is also very important. Why? Just because a patient is not doing workout, so anxiety comes out. माइंड में स्लोनेस है, सो इस वजह से सारी प्रॉब्लम्स है. व्हाट हैपन देन अगेन, memory will be weak and inferiority. Just a minute, my phone is there, so wait for a moment. I have okay. So memory will be weak and there will be forgetfulness. And what happened then, due to forgetfulness, so patient always do mistakes in reading and writing, in doing mathematical or arithmetic logical questions or anything. So what happens, so due to all that, inferiority comes in the patient. Always inferior, like if they are going to perform anywhere, there will be inferiority, there will be anticipation to perform anything, there will be withdrawal symptom comes after that. If there is inferiority, there is anxiety, there is insecurity. So these kind of symptoms come, and inferiority also comes. So what happened then, the patient gets withdrawal and patient becomes shy and timid. So that is why patient will not answer or not say anything in front of the anyone. So these kind of symptom you will find in the calcarea group. Although they are very creative, although they are very having great desire for everything, but they are not having any practical outcome, and due to all that, the withdrawal symptom always comes. Again, issue what happens.
সেরা ফলাফলগুলো শুনুন।
So same Baraita is very dull also, and mentally and physically both dwarfishness you will find over there. But in everywhere I have seen that there is written that Baraita is mentally and physically both dwarfish, right? No doubt in that. But patient is intelligent, patient is routinistic. Intelligent in way like what, why I am saying like that, because Dr. Kent has said about the Baraita that Baraita patient is routinistic. If he told that any worker in any company, like patient is doing 20 years 30 years in same company, and patient is not switching their company just because of same routinistic work. I have to go to work, I have to finish only this kind of work. So routinistic kind of activity you will find in the बराइटा पेशेंट. सो बराइटा इज इंटेलिजेंट. एक बार आपने एक काम समझा दिया तो पेशेंट उसी को रूटीन से बहुत अच्छे से करेगा. देयर विल बी नो एरर. But calcarea is not like that. Calcarea patient is always want something new, something different. They cannot stay anywhere at a single company or single place. They always wanted to do something because desire is high, desire is much. So that is why this kind of symptoms or withdrawal symptoms or shy and timidity comes. When we talk about the shy and timid behavior, so as I told earlier that Cilicia is also having same features, shyness and timidity. But timidity is not like a foolish behavior, not like lycopodium, not like Baraita carp and pulsatilla. Cilicia patient is very intellectual. They are reserved, but they are shy, but they are not timid. They are very intellectual kind of person. Timidity in the sense that they consume their energy to say something new, to deliver a productive knowledge in front of the people. So shyness, in terms of shyness, there will be there. My slide is not moving again. So I was talking about the sulfur. Sulfur is a very good orator instead of listener. Sulfur patient is hot, and patient is having great desire sweet for sweet, and raised philosopher, always talk about the philosophy. And you have read in many more books that patient wears a crown and lead the whole majesty, like he is everything. So haughty nature and egoistic manner, you will find out that patient is having ego for everything. When I was principal in this medical college, so I was like that, I was do, so I was now so nostalgic always. So then you need to understand, it's an observation which you slide is not moving. The problem. So this observation you need to understand ki why this is happening. So this is very important. You have to understand. You have to understand that why this kind of symptoms happening in the patient. So again, if you talk about the lachesis patient, इसमें कुछ problem है. This is not moving. Sulfur, dirty and filthy look. Stooping shoulders, standing is the most position of the sulfur. I already told in front of you. Patient is very diligent, egoistic, honest, extremely extroverted. Philosopher, raised philosopher, I told you earlier. Patient is hot, thirsty, and craving for the sweet. So these are the medicine which keywords which we have to understand. Now, when patient is coming in front of us, we have to understand these symptoms, which actually PQRS symptom, which we observe through the interaction of the patient. Again, natrimute, you all know about the property or doctrine of signature of the natrimute. Natrimute is prepared from the NaCl, and NaCl is a sign of the loyalty. NaCl have property of observe the moisture from the atmosphere, you know well. So it's a sign of the loyalty. Patient is very emotional, reserved, and very sensitive in nature. Patient, if you see the exact patient, so definitely there will be emaciation of the neck, thin neck you will find out. So this is a observation you need to understand. And hot attitude, डॉक्टर साहब प्लीज थोड़ा एसी तेज कर दीजिए. So some kind of medicine you have to understand. Hot is lachesis, hot is natrimute, hot is sulfur. So more questions you have to ask with your patient, and then you will find out some such medicine. Pulsatilla is also hot. So these question you have to ask after the conversation of your patient. And very anger, irritability, and you will find in the natrimure patient. Although natrimure is very emotional, very loyal person, and craving for salt, consolation, aggravation. If we talk about the consolation, then pulsatilla always want consolation, because natrimure are like, if you consolate her, she will get mad. She doesn't like consolation at all. Like Ignatia also. Ignatia also doesn't want like if anyone consolate her, she gets mad. And contradictory symptom you will find. Natrimure is generally a very loyal kind of person. If you have anyone, your friend or your family member like natrimure, you are very fortunate to have them, because they are very loyal in every way. And this is the very important thing which we are not getting that kind of person in this era. So natrimure person never believes on everywhere. Why? Just because just because of loyal attitude and reserve attitude, they don't interact with everyone. Just because they always want, they makes a wall, they makes a wall of emotional disconnection. What kind of emotional disconnection? When happen? Just because when she got cheated by anyone, and she is very emotional, she is very reserved and sensitive, she doesn't like any cheat attitude from anyone, because she is very loyal. She doesn't want any cheat attitude. And when she got cheated by someone, she becomes very indifferent, very introverted, and very reserved in same way, and makes a wall of disconnection. So if we talk about the indifferent, so she is not indifferent like sepia. Sepia is indifferent, but natrimure is not different. But if we talk about the cheat person, when anyone cheat her, she become indifferent in those kind of person, because she doesn't want any kind of cheat manner in any way. And then she becomes very irritable, very rude, sensitivity to rudeness, sensitivity to criticism, you will find in natrimure. So these are the symptoms you have to understand when you interact with your patient. When you talk with your patient, then these kind of symptoms you will find out. Now, Oramet is very conscientious kind of people, because Oramet has a very workaholic attitude and very gentleman kind of person. They are introverted. I told you earlier that they are very introverted and very diligent kind of person. They will smiling always, and always respect giving to everyone. When they got hurt, any kind of hurt, like if they are a good businessman, they are a good student, and they are a good doctor, but if they got any kind of mistakes in their attitude, or in by the society, by the environment. So they got feeling of the unworthy behavior or unworthiness, so they become suicide, or they got the suicidal tendency or something like that, because they are very workaholic, they are very industrious, so they are doing work for perfection. They never believe on cunning attitude and different kind of personality they are. They will very in nature, I will tell you that in morning they will come to you, they will do breakfast with you, and very normal nature. Very difficult to find out the automat personality. Why? Just because of if patient are spending their proper lifestyle in front of you, then how can you identify? How can you identify that she or he is having such problem, or something is going on in their mind or heart? So you will not identify. They will do lunch with your with you, and always daily routine they will perform, and at night they will commit suicide. So these are the attitude they wear. They are very introverted kind of nature, very difficult to find out. So observation your will be so introverted attitude. And the next is question of the attendant. So this also play the best role. You have to ask something about your patient with their attendant, so they will explain, and they will tell you about her or about him. So you need to observe over there. So physical, I will tell you that patient will be very chilly, thirstless, diligent, I already told you earlier, and they're very responsible kind of person they are. Suicidal disposition, when they have such kind of problem, so suicidal disposition always comes out. In syphilitic situation, it's a great anti-syphilitic remedy. So syphilis, where syphilitic to own destruction. Syphilitic to own destruction, when he or she commits suicide, or this kind of symptoms you will find in many more now generation. That if patient, if any boy or girl is staying in hostel, if anyone hurt them, so what happened, they commit suicide. So different kind of examples we find out of the automat personality. So they are not explaining anything or everything about them, but they commit suicide. Nitric acid is very anarchist kind of person. If you see, you already see the image of this guy. He's very looking like a villain, looking like anarchist kind of person. So patient is looking ugly appearance, you can see over here. An anemic and emaciated person, so Phulan Devi and is a great example of that. Why? Because they had a great humiliation, they had a great dominating history in their life. So what happened, different kind of person, if they had a great humiliation and domination in their life, they become very anarchist in their future. So we have a multiple kind of person. One who is observing everything, observing and makes a silent grief in inside, like staphysagria and many more medicine. And some like nitric acid, so they become anarchist, revengeful kind of. Lachesis is also revenging kind of. Lekin what happens, Lachesis person is staying in front of you, in company with you, but what happens, they do revenge, but you will not understand कि ये कर सकता है ये आपके साथ बुरा। क्यों? क्योंकि आस्तीन का सांप पहले से भी ये चीजें कही गई थी कि लेक्सिस का जो डॉक्ट्राइन ऑफ नेचर है, जो लेक्सिस का सिग्नेचर है, वो यही है कि आस्तीन का सांप अगर आप उसको दूध पिलाते हो तो दे विल हर्ट यू, आप पहचान भी नहीं पाओगे और वो आपके साथ बुरा कर जाएगा, जस्ट बिकॉज ऑफ डिसीटफुल एटीट्यूड, जस्ट बिकॉज ऑफ कनिंग नेचर। यू कैनॉट अंडरस्टैंड, बट नाइट्रिक एसिड you can understand. लैकेसिस यू कैन नॉट अंडरस्टैंड, क्योंकि आपके साथ में रह के वो आपको डिसीट कर जाएगा, आपको फूल बना जाएगा, आपका बुरा कर जाएगा. सो different kind of revengeful attitude you have. So when we talk about the nitric acid, many more symptoms, like patient will be very anxious and irritable, kind of destructiveness will be on high top. Anarchist kind of people they are. They have a great domination and humiliation history. So they wanted to do revengeful attitude towards that guy or everyone that they have done wrong with me. So I will not leave her. Yeah, leave him, yeah, leave them. So these kind of attitude they have. After abuse of mercury, nitric acid is a good choice, and it's a very good remedy for the medicine for the piles or different kind of pathology where there is the bleeding and involvement of the skin and mucocutaneous membrane. So what happened, there is a bleeding comes out, and it's a very good medicine for the mucocutaneous junction where there is any kind of pathology comes out anywhere. And nitric acid patient is very chilly and thirsty, or maybe thirstless. So this is not decided yet, but the people are non-diligent kind of, careless, and aversion to touch of. So when we talk about the nitric acid, so very important symptom you have noticed in nitric acid, the offensive urine like horse. So different kind of smell is there. And nitric acid is also a very good remedy. It's a great syphilitic remedy, psychosyphilitic remedy, I will tell you. So these kind of symptom you will analyze and you will observe during the interaction of your patient. Carcinosin has a great story. How can you understand the carcinosin patient? Very important. If patient is having the silent grief of 10 years long, 20 years long, and different kind of humiliation and domination has been done with the patient or something like that. If patient has had any child has a different kind of dispute in their parents, or there is a quarrelsome kind of a history in their parents. So what happened there, you have to understand, there you have to understand ki patient has a great silent grief inside, storm inside. So that is why the patient has a great silent grief inside. So 10 years, 20 years grief inside, so patient becomes very artistic to their drawing or towards the nature, towards the dancing, singing, whatever they want. So they convert themselves in different kind of attitude or different kind of behavior. The patient will become very segregated herself or himself for uh, different nature or for animal lover. So they become like that. They think that family or life is about everywhere, is about sorrow or grief everywhere. So they always become like creative or fond of drawing and something like that. So graceful they are, conscientious they are very diligent kind of person, बहुत अच्छे होते हैं. But history is not good. पेरेंट्स की लड़ाई, फैमिली की लड़ाई, और circumstances like कहीं भी अगर family members में भी everyone is very dominating and humiliating kind of, so they become they are very graceful. They are not opposing anywhere or everywhere. They are keeping everything inside. They are not opposing in everywhere. Why? Just because of diligent attitude, just because of they are very cool and calm kind of personality, phlegmatic kind of personality. So what happened, they keep everything inside and became storm inside. So what happened, so due to all that, many kind of pathology, like a cancerous kind of pathology comes out, or tumor, any growth, cyst, fibroid. So these kind of symptoms or pathology comes in the patient. So we have to analyze, we have to assess the exact last history of the patient. That will help out to analyze and to get the simillimum in the patient. So what kind of symptom you will find? That bites the tips of the finger like this, you will find. So this is the observation. In anatomy also you will find. So this is the observation. In anatomy you will find like that. So patient will be sitting over in front of you like that. So definitely it shows the behavior, sensitivity or reserve behavior. Very caring kind of person, mild and sensitive also. And they are very diligent, love for music and art. Or I already told you that if they got the life is very hell, life is not giving proper uh, love, so they becomes close to nature, close to animals, and close to music and art and dancing and everything. So these are the ailments from which we have to analyze from the complete case taking. So these are the observation points which we already used to ignore. We have to analyze. Okay, triple seems important because in something, so the trifles became irritate them. Anticipation affects them profoundly. That if we have a great storm, if we have a great multiple silent grief inside, someone has raped me, so I got anticipation, and I am a patient. And when we open our door, I have a great anticipation, whether he is coming or not. Maybe he again raped me. So anticipation affects them profoundly कि maybe वही फिर से वरना आ गया हो, then again it incident come or affects me. So they have a great anticipation of everything because they have a great silent grief. Again, multiple kind of attack or humiliation and domination, they got hurt. Extremely fastidious they are, like natramure, like tuberculinum, like arsenic and many more medicine. They have a great love for chocolates and desire to be careless. It's a great symptom of carcinosin because they are deserving, but they didn't get um, ever love from their parents, from their family members, from now ignatia is very good remedy for the hysterical activity, where you will find definitely ignatia will be first choice. Like actia is also there, but ignatia is the first choice. Thick neck, uh, Natramure has thin neck, emaciated, and straight hair. This is the observation you need to analyze. Straight hair, thin hair, you will find patient is very quick to perceive anything. Extroverted, they can be introverted, but they are very creative. Appreciation, desire of everywhere, and attention seeker. And what you will find, contradiction is a very important symptom in ignatia. Patient contradiction of everything, contradiction, consolation, aggravation, like natrimute. So these are the symptoms you have to observe when you taking your case taking. And patient will be chilly, thirstless, aversion to tobacco, very important symptom. कहीं भी पेशेंट स्मोक कर रहा होगा या ऐसे कुछ ले रहा होगा तो पेशेंट गॉट हर्ट, तुरंत उस पे रूड अब्रप्ट होके पेशेंट विल से ये आप प्लीज यहाँ मत करिए, यहाँ से जाइए. तो दिस इज द ऑब्जर्वेशन you have to assess when you get the simillimum. Long standing grief like staphysagria, but staphysagria is very different kind of personality. Although patient has a great storm, but patient will be very shy, very gentle, very mild. They will not oppose and keep everything inside, like carcinosin. So something different kind of symptoms or differentiation will be there. Audacious attitude you will find out in the ignatia. Patient will be very diligent, and patient will be very competitive kind of. What you will find that patient is very introverted and attention seeker also. If patient is coming to your clinic, husband will say, मैम बार बार दिन में यही पूछती रहती है, ये मैंने कैसा बनाया है, ये सब्जी अच्छी लगी क्या, ये देखो मैंने पेंटिंग बनाई है, हाउ इट्स लुक्स. सो इस टाइप से अप्रिशिएशन डिजायर ऑफ होती है. तो इसकी वजह से पेशेंट ऑलवेज यूज टू आस्क कि कुछ अच्छा फीडबैक मिल जाए फ्रॉम द फैमिली मेंबर्स, फ्रॉम द हस्बैंड, किसी से भी अच्छा फीडबैक मिल जाए. अटेंशन सीकर होते हैं. अटेंशन सीकर होने की वजह से हिस्टेरिकल एक्टिविटी भी परफॉर्म करने लगते हैं. आप पल्सटिला में भी ये चीज पाओगे, आप इग्नेशिया में भी ये चीज पाओगे. क्यों? क्योंकि उनको अटेंशन चाहिए, सबसे चाहिए कि शी विल सेंट्रलाइज इन फ्रंट ऑफ द फैमिली और इन फ्रंट of the society or everywhere. So these we have to observe and analyze. When we okay, now see, time is more actually. Everyone has to go for dinner, but we have stress, so sorry for that, because content is more. All are deep constitutional remedies and deep acting medicine, so that's why I wanted to explain. So no worry, I will share your my presentation towards you all, but I am going to explain some key words in front you all. So when we talk about the CPI, CPI is very competitive and managed women. Stasis is a very important symptom. When there is it's a key of CPI, where you find, because just because of why it's happened, because due to not achieving her ambition. So that kind of stasis comes in her life. And patient is very miserly. Always you will find in CPR patient rejects affections, indifference to those love for the love the most. Why? Just because of she always believes that due to family member, due to all that thing, I have not achieved my goal, I have not achieved my ambition, so they are the responsible one. That's why the indifference comes in her. So that is why they become indifferent to their loved ones and family member also. Patient is chilly, thirstless, and they can be diligent or non-diligent. Why I said this one? Because they are very caring about their family. And when she is not getting whatever she wants, so they became non-diligent, they became irritable, they became very rudy, and so just because of these conditions. So वैसे this is also known as the washerwoman remedy. You know all well. Platina is also having a great role. It's a deep constitutional remedy, and you can see in this picture the superiority complex is on the top, or arrogance, proud, you will find in the platina patient. Highly successful person, they are actually, they are achievers. They want, they dress up herself, or due to create affectation, they wants to achieve everything. They want position, they want of designation, everything they want. Just because of achieving everything, they want a proper place. So that is why they are doing such activity. Doesn't argue or contradict, and caste of the people against her will. She doesn't want any argue with people. And mannish women like CPI you will find in platina. Effeminate men, and always having superiority complex. Hot patient, non-diligent, and left-sided remedy. So in Platina, you will find such kind of activity. Time is very less. Otherwise, I wanted to explain, but no worry. I will send my slide and I will explain any time personally. So now, very important thing is different kind of medicine is pulsatilla. Pulsatilla is very cute looking, mild, yielding disposition, weeping tendency. I told you, abrupt in soft manner. ये सब्जी मैंने बनाई, आपको अच्छी लगी क्या? मैंने आज आपके लिए ये प्रिपरेशन किया, आपको ठीक लगा क्या? But not like Ignatia. Ignatia is asking, or even in rude manner, she say always. And in Natramure, it's the same thing. But in Pulsatilla, मैंने ये बनाया, आपको अच्छा लगा क्या? So this kind of question patient ask. Naive is very important symptom because patient is very naive, and symptom changeability. Different abhi problem sir mein hai, now again in knee, again in stomach and back, and there will be symptom changeability you will find. Symptom apart from symptom, you will find the different discharge also. Yellowish greenish discharge you will find in the pulsatilla. And craving for fast food, you know well that pastry desire, fast food desire, burgers, chow mein, and Chinese and all kind of food material they want always. Desire consolation, patient is very shy, timid, but when you query, or when you get familiar with them, they become very familiar and explain everything towards you, because they want consolation, they want attention. Very emotional they are, sympathetic, and sympathy seekers also, when people feel pity for them. And patients are effeminate, self-centered, open air desire. If they having any kind of problem, any pain, any problem, they want open door, open window to relieve their pain. So Lilium take like almost like agentum metallic, agentum nitricum medicine. So hurried and worried people, they are suited to unmarried women who are very aware, very amorous in nature, and having sexual desire more like nymphomania, I would say. And suited to unmarried women, they are working in urban areas. And like Platina also, Platina has also nymphomania. And bearing down sensation you will find if there is any kind of uterine pathology over there. Patient is very hot, like iodum. And consolation aggravation is also there. Patient is listless, restless, nymphomania, confused ideas, and desire to curse and swear, like canina myocardium also. So lachesis, I told you in previous slides that facial expression means a lot. So you can see in this face of student, uh, so patient is physically obese, mentally active, but beta phone mentally active but physically inactive. Physically they are very obese. You know the doctrine of signature of the legacy, it's prepared from the surukuku. Patient is very deceitful, very cunning, and very much sharp and quick, active in night. जो भी प्लानिंग करनी है रात में करनी है, और ऐसी करनी है कि नेक्स्ट डे उसको इम्प्लीमेंट करना है. Blackish discoloration you will find. Patient is very hot, thirsty, but thirstless in acute state also. You will find the cunning nature, frivolous, non-diligent kind of person, and they are loquacious, always talkative, always loquacious like sulfur. But they are cunning. Sulfur are honest. Sulfur is very honest person, but lachesis are very cunning, extreme extroverted, very sharp observer, and excellent salesman. मिट्टी भी आपको सोने के दाम पे बेच देगा. So we have only 2 cases. If you want, I will explain. Otherwise, I will share my slide, so that will easy to understand. Shweta, have I time?
No,
Can
ma'am.
I explain?
No, ma'am. We are running out of time.
Your voice is not audible.
Uh, there's no time, ma'am. We are running out of time. Sorry.
So I have a two case, but I think there is time issues. So I will share my slide towards you all, so that will help out to understand actually how we are taking the case, how what kind of symptoms or rubrics we have to analyze. Actually, some slide is more, time is very less, so difficult to understand because it's both case are very large, so difficult to understand. I will share my slide. You can understand the exact manner how to take case taking and how to repertorize in which manner. Okay. Actually, I didn't saw time, and laptop was also working very problem, not good to do slide share.
It's okay, ma'am. And thank you so much for this nice session. However, there were many technical disturbance.
Shweta, you are not audible.
Am I audible to all?
No, I'm not able to hear you.
Am I audible? Any
Yes,
participant?
yes, Shweta, we can hear you
Yeah, there is some technical error Dr.
with from
Pooja.
Pooja Nayak, madam.
Yes, yes, sir. So thank you for the sessions, and now we
Why?
would like to appreciate both the
I'm not
speakers.
audible. No, you are not. आवाज क्यों नहीं आ
Al-
रही? बोल रही है।
Thank you, Dr. Hira, for explaining all the questions, for clearing all the questions in the chat. And we don't have any more questions out there in the chat. And now we would like to appreciate our speakers with the appreciation certificate. Congratulations, sir, for the certificate. Thank you for your gracious presence and for sharing your experience and wisdom with us. Congratulations. Congratulations, Dr. Pooja, for the session, for the wonderful session. And please accept this certificate on behalf of KHA Homeopathy Study Group team. Thank you. Let me announce the upcoming December webinar that is on 3rd December 2023 at 8:30 p.m. India timing and 11 a.m. US and Canada Eastern Time. We will have Dr. Kusum S. Chand and Dr. Poonam Shablani who will enlighten us on topic extrapulmonary TB with multiple abscesses. You can find the link to register at our website kavitakhombeo.com and don't miss the webinar. Now, heartfelt thanks to our speakers and to our viewers to join us today. We have many such informative webinars lined up in the upcoming sessions with many more renowned homeopaths. For the upcoming webinar info or any other updates, follow our social media channels, handles at Instagram, Facebook, Twitter, LinkedIn, etc. If you've missed any of the webinar, you can watch it at our YouTube channel with the name Kavita Kukunur. I'm thankful to all the KA volunteers who joined us today and for their continuous support and selfless services with which we are able to organize these webinars in successful manner. For any other info, you can reach us at kastudygroup@gmail.com. Thank you all for joining us today.
Thanks a lot, Sweta. Thanks a lot, Sweta, and the whole
Thank you.
Ka family. Thank you.
Thank you so much, sir. Thank you, Dr. Pooja. Shall we end, sir?
Hello,
You want to
Sweta,
say
I'm
something?
not able to hear you. You are not audible at all.
You are not hearing us.
I don't know why.
So sorry. There is
Because
some
I am
technical
already
error at your side.
unmuted and why? Don't know. I'm not able to hear you.
I'll call you, ma'am.
Well,
For sure.
thank you so much for giving
Thank
me opportunity. Some problem were there just because of slide sharing, and time is also very less and slides were too large. So I will share you. Please send to everyone so that will help out to understand everything.
Sure. Yes. And to the participants, please don't miss the jot form. Please fill that form which is shared in the chat to receive your participation certificate. You will get it within 10 days. Thank you so much for joining. Good night to all.
Thank you.
Goodbye to all. Thank you.